As we move on from standard to transmission-based precautions, we will focus first on contact precautions, which are designed to reduce the risk of transmission by direct or indirect contact with patient materials or secretions. Contact precautions also involves appropriate patient placement inside rooms. It involves gloves and hand washing when entering the room, gown when entering the room, transport limitations to help prevent unnecessary movement of the patient in the hospital environment, and also deals with specific types of equipment and dedication of that equipment to individual patients such that it not be shared and facilitates and therefore facilitate transmission of infection between individuals. Examples of the types of pathogens involved in contact precautions include methicillin-resistant Staph aureus or MRSA, herpes simplex, herpes zoster, which is the causative agent of shingles, cholera, we don't see that terribly often in the hospital setting, Clostridium difficile, the cause of very severe colitis is often encountered in hospital patients, viral conjunctivitis, and viral hemorrhagic fever is a situation that we saw when Ebola was present on U.S. shores in 2014. Droplet precautions deal with generation of aerosols, as you can see this patient doing, actually an individual, not a patient, but during the course of a sneeze. Droplet precautions are designed to reduce droplet transmission of infectious agents, and these kinds of droplets can establish contact with mucous membranes. The particles themselves are relatively large in size, approximately 5 microns or greater, and may carry microorganisms within them. They're generated during coughing, sneezing, talking, suctioning of patients during hospital procedures, bronchoscopy, intubation, and the like. Droplet precautions are in place to help deal with close contact that might occur. Droplets generally travel only 3 to 6 feet or less and don't remain suspended in the air, so they're not a major concern over long periods of time or over long distances, but rather over a short distance in which you might encounter in the general separation between individuals who might be having a conversation. Also, as part of droplet precautions, we have restrictions on patient placement. Generally, these individuals do require a private room or are cohorted together, individuals with the same infection, such that they're not going to be transmitting to other people who don't yet have infection. Or if there is not private room capability, to maintain at least a 3 to 6 foot spatial separation if possible between them. A mask should be worn by individuals who are coming into close proximity to these individuals, that is within 3 to 6 feet of an infected patient. And during transport, first of all, limited movement should be applied. That is, people who are in these precautions should not be moved around unnecessarily, and masking of those patients should be employed, if at all possible, to help minimize dispersal of droplets when those persons might cough or sneeze. Examples of types of pathogens that are spread through droplet aerosols include Haemophilus influenzae, Neisseria meningitidis, which is these are both causes of bacterial meningitis, pertussis, of course, whooping cough, pneumonic plague. Plague actually can be transmitted in the pneumonic form from person to person. Mycoplasma pneumonia, common cause of outpatient or so-called walking pneumonia. Group A, strep infections, scarlet fever, common influenza, of course, mumps, which we're seeing a resurgence of in certain parts of the U.S., and again, viral hemorrhagic fevers, as was experienced during the cases of Ebola hemorrhagic fever, which were seen in the U.S. A couple of years ago. We'll move on to our final area of transmission-based precautions, namely airborne precautions, in the next section.